Thank you, Mr. Chairman. My first kind of set of questions is really just to the panelists from the VA directly. I'd love to hear from each of your perspectives, just a general question about gaps in care, access to care that you see within the VA, and what those barriers are that exist in filling those gaps, especially in our rural communities, obviously, with the topic today. And then just to ask you in addition, what kind of feedback you get from veterans as it relates to these gaps and filling them. Yeah.
Well, thank you, Congresswoman. So I would say there are certainly less opportunities for rural veterans, especially the more specialized the services that they are. And so throughout Vision 12, we have a fair amount of rural areas, not only in VA Ileana, but in Iron Mountain particularly, where it's literally a 4.5-hour drive from Sault Ste. Marie, the CBOC, to the main campus. I think when it comes to primary care and mental health treatment, we've both virtual and face-to-face is where we've really been able to close the gap more so. But we are continuing to expand our CBOCs, not only growing them and doing construction, but also trying to create new specialty services there. But certainly across the board, that's why I think community care, as was stated, is so critical, because we can do a lot in the VA. We have a lot of opportunities that we can offer for our vets, but there are some things that we can't. And so having that partnership of community care can really help us. There's a lot of mobile opportunities that we do too, and I think maybe Dr. Kaboli could talk a bit more about that.
Okay, so here at VA Ileana, and I actually have spent over 30 years in healthcare, specifically relating to providing services to individuals in rural areas. So rural healthcare is a passion for me. At VA Ileana, we have actually implemented a screening program titled ACORN, which stands for Assessing Circumstances and Offering Resources for Needs. And to speak to some of the testimony that we've already heard, when we've done this screening through our social work team, it really addresses some of the social determinants of health, like food, housing, utilities, transportation, education, employment, digital needs, and the like. We've actually found that 19% of our veterans are positive for digital needs, and another 65% positive for social isolation and loneliness. Since we are a rural Department of Veterans Affairs hospital, we do have, CBOCs spread throughout this area, but we certainly recognize the needs of our veterans to try to remain connected with not only health care, but with one another.
I just want to say, to start out, though, I'm actually from Iowa City, Iowa. I grew up across the river from Illinois in southeast Iowa, so go Hawks. We have the Big Ten covered here. But I did wear my Illini colors today,
yes,
just
thank you.
Because I knew where I was. No, I think to answer your question about access and gaps, I think it comes down to sort of kind of like Ms. Rain said about you use every possible thing you have. What do we have that we can get veterans access to care? So it's face-to-face care with us, face-to-face care in the community, telemedicine, instant messaging. We have all these things offered out there. And the thing is, not every veteran wants telemedicine. Of veterans that have used telemedicine, 80% say, yes, I want this. 20% say, I tried it, it's not for me. And pretty much all of us had some form of telemedicine during the pandemic. So we've had experiences with it, and really veterans want more telemedicine. But again, what do they want? Let's either bring them to care or bring the care to them.
Yeah. Could I ask just one follow-up question? One thing I've noticed within the district, just within healthcare in general, just even beyond providing care to veterans, is we lack the ability to attract specialty care, healthcare professionals, doctors, nurses, and so we have a shortage of healthcare professionals just within our hospital systems. Is that reflected as well at the VA in Danville, that you have those shortages or a hard time kind of attracting those professionals?
we have very similar challenges to what are experienced in the private sector and the community care network, yes.
Yeah. Okay. Yeah.
If I can add to that, I think one of the things that we do have is because we're a national network of providers, we actually don't have a shortage, say, of primary care providers. Even though there's shortages everywhere, we just don't have them all in the right places at the right time. And so, like you were talking about PAC teams and how many providers they have, we can supplement that through the Clinical Resource Hub program. So we can supplement primary care, mental health, specialty care. So a nephrologist in Boston who has extra effort to give can provide care in rural Illinois. And that's when
Telehealth.
by telehealth.
Yeah,
yes.
telehealth is key to that.
Yeah.
Yeah. Okay. I'll go ahead and yield back.
Sure, thank you.